A 67-year-old man was found lifeless in his bedroom last spring. His heart gave out, right in the middle of intimacy. The cause? A hidden vascular issue. No one warned him, not even his doctors. His wife said it was the first time they'd been intimate in months. What was meant to be a moment of reconnection ended in silence. I'm Dr. Anthony. For over 30 years, I've worked with aging men, veterans, husbands, grandfathers, helping them take back their health, their confidence, and yes, their ability to perform. I don't sell hype. I offer real, medically backed solutions for real men. And here's what most men don't realize. Your penis is often the first warning sign of heart trouble. Weak erections usually mean weak blood flow, not just down there, but throughout your body. The surprising part? The most effective solution isn't a pill, it's movement. 5 simple exercises, some don't even involve your groin, can boost blood flow, strengthen performance, and protect your heart, marriage, and dignity. Stick around. The final exercise I'll share is the same one I prescribe to post-surgery patients to restore function without medication. Let's begin. Before we dive in, hit subscribe and tap the bell icon so you never miss another life-changing tip designed specifically for men like you. And if this message resonates with you, type 1 in the comments. If it doesn't, type 0. Your feedback helps me help you better. Exercise. 1. The forgotten muscle group that controls erections. Pelvic floor activation. Kegel exercises. Most men associate strength with their arms or chest, but when it comes to sexual performance, the real powerhouse is hidden deep inside, your pelvic floor muscles. These muscles control erection firmness, ejaculation timing, and even bladder function. Kegel exercises, named after Dr. Arnold Kegel, are the most effective way to strengthen them. These aren't some internet trend. Kegels have been prescribed in clinical settings for decades, for men recovering from prostate surgery, those struggling with ED, and even elite athletes seeking core stability. Here's why they matter. When pelvic floor muscles are weak, blood doesn't stay trapped in the penis during an erection. But when they're strong, they act like a valve, holding blood in, helping you stay firm longer. They also give you better control over climax, a big win as we age. And here's the best part. You can do Kegels anywhere. In line, watching TV, or lying in bed. No equipment. No embarrassment. Just consistency. How to start. To find the right muscles, try stopping your urine midstream. The muscles that lift inside, that subtle squeeze, those are the pelvic floor. Once you can isolate them, squeeze and hold for 5 seconds. Relax for 5 seconds. That's 1 rep. Do 10 reps per set. Repeat 3 times a day. Morning, afternoon, and evening. Can't hold for 5 seconds yet? That's okay. Start small. Like any muscle, it'll strengthen with time. In a week or 2, you'll feel tighter control. In 3 to 6 weeks, many men notice firmer erections, better sensation, and more confidence in bed. Want to level up? Add breathing. Inhale through your nose as you squeeze. Exhale through your mouth as you release. This calms the nervous system and helps reduce anxiety, a hidden killer of male performance. 1 warning: don't squeeze your abs, thighs, or butt. This is a precision exercise, not a power lift. Think of it like cracking a safe, not forcing it. Over time, increase the hold to 10 to 15 seconds. Add pulses, quick squeezes and releases, to train stamina and reaction. These mimic the natural contractions during climax, helping you reclaim the rhythm and control you may have lost. Why it matters? Kegels aren't just about function. They're about confidence. Knowing your body works. Showing up as a man in and out of the bedroom. With just a few minutes a day, you may feel younger, stronger, like you've turned back the clock, without a single pill. But that's only the beginning. Next, I'll show you a powerful therapy that pulls blood directly into the penis. No pills, no arousal required. Let's continue. Regain morning wood and spontaneous arousal. Naturally. After just a few weeks of consistent vacuum therapy, many men report waking up with morning wood again. Some even regain spontaneous arousal throughout the day. It's not magic, it's science. A few men combine this approach with medications like tadalafil for added results, but that's something you should only consider under the guidance of a qualified doctor. But here's something we often overlook: the emotional impact. When a man sees his body respond again, after months or even years of disappointment, something powerful shifts. Hope returns. Confidence rebuilds. Relationships begin to heal. The man who once felt defeated starts to feel alive again. This isn't about vanity. It's about dignity, function, and control. Reclaiming ownership of your body and your masculinity. And when a man feels in control, everything else starts to fall into place. Penile extender, quiet. Passive, surprisingly effective. Now, the next method is even less known but just as powerful, and it doesn't involve pumping or squeezing. It's passive, works quietly over time, and for many men, it not only improves erectile function, but can even lead to noticeable increases in size. Let's talk about the penile extender. You might think it sounds like a late-night gimmick, but this device is actually a medically studied tool used in clinical settings across Europe and increasingly in the US, for one simple reason. It works, when used correctly and consistently. A penile extender applies gentle, steady traction to the penis. Over time, this process, called mechanotransduction, encourages the body to create new cells and expand blood vessels. That means better circulation, improved tissue health, and yes, in many cases, an increase in length and girth. Most importantly, it helps restore what many aging men lose: vascular elasticity and erectile strength. Men recovering from prostate surgery or dealing with long-term erectile dysfunction often use extenders under medical supervision as part of a larger rehabilitation program. The protocol is simple, but requires patience, typically 1 to 2 hours per day, 5 to 6 days per week, over several months. Traction should start light, gradually increasing over time. The key is gentle consistency, not force. Some newer devices are even discreet enough to wear under loose clothing while working or relaxing at home. And here's the real power. It's not just about physical improvement, it's emotional too. For many men, this quiet daily ritual becomes a way of reclaiming control, of saying, "I'm not giving up on myself." Confidence grows, not just in the bedroom, but in everyday life. But caution is essential. Always choose a medical-grade, clinically tested device recommended by a doctor or urologist. Avoid cheap knockoffs that can cause harm. This method isn't about cosmetic change. It's about restoring function, confidence, and pride in your body. And for many men, the results are worth every minute. Wall squats, a surprisingly powerful erection booster. Now let's switch gears. This next technique is active, but has nothing to do with your groin. In fact, it starts with your legs. Wall squats. Sounds simple, right? But this basic move may hold the key to stronger, more reliable erections. Why? Because your legs contain the largest muscles in your body. When they work, they demand oxygen and blood, lots of it. That demand improves your cardiovascular system, boosts blood circulation throughout your body, including to your pelvic region, and stimulates the release of nitric oxide, a key molecule that helps you get and keep an erection. Even better, wall squats trigger natural testosterone production. As you age, your T levels decline, but activating large muscle groups tells your body to start making more. naturally. Here's how to do it. Stand with your back flat against a wall. Place your feet shoulder width apart. Slowly slide down until your thighs are parallel to the ground. Hold the position like you're sitting in an invisible chair. Start with 20 seconds. Build up to a full minute over time. Rest, then repeat for 3 to 5 rounds, 3 to 4 times a week. It's low impact, requires no equipment, and it works at any age. If you stick with it, not only will your legs grow stronger, your energy, confidence, and sexual vitality may follow. Deep diaphragmatic breathing, the silent reset button. Finally, let's address something most men never talk about, the mental side of sexual health. You can exercise, eat clean, and even take the best supplements. But if your body is constantly stuck in fight or flight mode, arousal will never feel natural. It's not your fault. It's your nervous system doing its job to protect you. That's where deep diaphragmatic breathing comes in. When you breathe slowly and deeply from your belly, not your chest, you activate your body's rest and digest system. This calms your nerves, lowers cortisol, and tells your brain, it's safe. You can relax now. And when you're calm, your body can finally allow desire to rise again. Here's how to practice. Sit or lie down in a quiet space. Place one hand on your chest and one on your stomach. Inhale slowly through your nose, letting your belly rise. Exhale through your mouth, letting your belly fall. Repeat for 5 to 10 minutes daily. This simple act can lower stress, improve sleep, and yes, restore your natural rhythm of arousal. In summary, vacuum therapy brings blood back where it belongs. Penile extenders restore tissue health and function. Wall squats boost testosterone and circulation. Breathing deeply calms the mind and resets the nervous system. You don't need to rely on pills or lose hope. With the right tools, knowledge, and consistent effort, you can rebuild what time and stress may have taken away. This is your comeback. And that's exactly what your body needs to allow blood to flow freely into the penis, stimulating the right hormones and supporting full arousal. Now, contrast that with shallow chest breathing, something many men do without even noticing. This type of breathing sends a different message to your brain, that you're under threat. Cortisol, the stress hormone, rises. Blood is redirected away from the reproductive organs. Your heart rate climbs, but your sexual desire shuts down. It's like trying to light a fire in the middle of a windstorm. No matter how much fuel you add, the flame just won't catch. That's why I've taught deep diaphragmatic breathing to hundreds of my patients, and why I use it myself. It's free, it's immediate, and it works. When practiced consistently, this simple technique can lower blood pressure, regulate your heart rate, reduce cortisol, and create the ideal internal state for arousal and intimacy. Here's how to do it. Sit in a chair with your feet flat on the floor. Place one hand on your chest, the other on your belly. Inhale slowly through your nose for a count of 4. Feel your belly rise, not your chest. Hold for 4 seconds. Then exhale through your mouth for 6 seconds. As you exhale, picture your body softening, relaxing, letting go of tension. Do this for 10 minutes a day, ideally in the morning or before bed. At first, your mind may wander. You might feel silly or impatient. That's normal. But stick with it, and soon you'll notice something subtle but powerful. A shift in your baseline. You'll feel calmer, more present. And yes, you'll begin to notice more frequent, natural erections, especially those spontaneous morning ones, a key marker of vascular and hormonal health. Even more encouraging, deep breathing can help rewire emotional patterns that often block intimacy. It opens the door to vulnerability, and with it, deeper connection. Many of my patients have told me this practice didn't just help their erections, It helped them show up more emotionally present, more connected, more like the man they remember being. Most importantly, it gives the power back to you. Aging can make you feel like you're losing control, but your breath, that's yours. And when you learn to master it, you unlock a level of inner control that no pill can offer. Now, you've reached the end of all 5 techniques, from pelvic strength to breathing depth. Each method plays a role, but together they create a full, natural path back to sexual vitality, without side effects and without shame. All that's left is to begin. What you need to do today, not tomorrow, not next week, today. Because the sooner you start, the sooner your body responds. In just a moment, I'll show you exactly how to begin, from your first breath to your first real breakthrough. By now, you've seen the full picture. 5 proven methods to improve erections, boost blood flow, rebuild confidence, and reconnect with your partner. But knowledge isn't enough. Action is what brings results. If you've ever looked in the mirror and wondered if your best days are behind you, if you've quietly feared that something essential is slipping away, this is your turning point. Start with just one technique. Don't try to do it all at once. If Kegels seem manageable, begin there. Sit down, locate the right muscles, and do 3 short sets. It'll only take 5 minutes, but it's a powerful first step. Or if stress has been your biggest barrier, begin with deep breathing. Close the door. Tune out the noise. Let yourself breathe with purpose. These small moments of intention can spark big change. Feeling more physically ready? Add wall squats. No gym, no trainer, just a wall and your body. Even 20 seconds is progress. If your challenges are more advanced, look into using a high-quality vacuum device or extender. These tools have helped many men restore performance when nothing else seemed to work. But wherever you choose to start, just start. You don't need to be perfect. You just need to be consistent. Even 5 minutes a day can mark the beginning of real, lasting change. And here's the truth. No one tells you. Your body still wants to respond. You're not broken. You're just out of practice. These methods aren't about becoming someone new. They're about reclaiming the man you've always been, before stress, age, or illness interfered. Write it down. Put it on your calendar. Treat this like a doctor's appointment you can't miss. The more structure you give your commitment, the more your mind and body will follow. And when that first strong erection returns, when your partner sees the difference in you, you'll know every second was worth it. You've lived through years of doubt, of silence, of not knowing if things would ever go back to normal. Now, you have the answers. You have the science, and you have the tools. The power is no longer in the hands of drug companies or ads selling quick fixes. It's in yours. So take that breath, do that set, try that squat. Let today be the day you start coming back to vitality, strength, and real intimacy. Not just for your partner, but for yourself. Because in these final moments, I want to give you something even more important. Something that ties all of this together. If you've ever felt like age was taking more than it was giving, you won't want to miss what's next. Let's finish this strong. Closing thoughts. The strength to begin again. There's a quiet pain many men carry with age. Not one that shows up on lab tests, but one that's just as real. It's the fading erection, the growing emotional distance, the subtle sense that something vital is slipping away. And too often, we suffer in silence. We adapt. We hide. We tell ourselves it's just part of aging. But let me say this clearly. It's not too late. Not even close. What you've learned here isn't hype. It's not magic. It's something far better. It's real. A roadmap. A toolkit. A way forward. These aren't just strategies for better blood flow or hormone balance. They're steps toward regaining control, confidence, and connection. Think back. Kegel exercises to rebuild your core sexual muscles. Vacuum therapy to increase blood flow and restore tissue health. Penile extenders to restore lost length and improve function. Wall squats to naturally raise testosterone and energize circulation. And deep breathing to reset your nervous system and revive intimacy. Each one serves a unique purpose, but they all lead you back to the same destination: balance. If you are still listening, then I know something important. You haven't given up. You still believe that something better is possible. And that belief, that's the most powerful tool of all. Because aging doesn't mean becoming less of a man. It means becoming a wiser one. Strength isn't pretending nothing has changed. It's choosing to change what you can. You can feel desire again. You can reconnect. You can look in your partner's eyes and see both love and attraction reflected back. And you'll feel proud, not just for the physical changes, but for the ownership you took when it mattered. So let me leave you with this. Start small. Stay consistent. Be patient. This isn't about chasing youth. It's about reclaiming vitality in the body you have today. I've seen men in their 60s, 70s, even 80s, transform their health and their relationships through these methods. Not with hope alone, but with action. You're no different. Your story is still being written. And if today is the chapter where things begin to change, then weeks or months from now, you'll look back and realize you didn't just fix a problem. You rebuilt a part of yourself that was never truly lost. Now, it's your move. And I believe in you. If this message spoke to you, don't keep it to yourself. Like this video to let us know it helped. Share it with a friend, a brother, or a partner who needs to hear it. And in the comments below, type "I'm ready" if you're taking that first step today. Or share what part resonated with you most. I read every single one,